Hi, my name is Natasha Sombie. I am currently a senior in the BSN program here at Youngstown State University. So I was born and raised in Sierra Leone, a little country in West Africa. We did have a 10-year-long war that kind of deteriorated the education and healthcare system. So I've always wanted to be in the medical field somehow. I've always had the inclination to be a part of the Ministry of Healing, to make people feel better. And I couldn't really get that at that moment in Sierra Leone. So I was researching schools and stumbled across YSU. I saw how the community feel of like the student ratio to the professor ratio, and how well the education system here was. And they also have like pretty affordable programs. And I was looking at the nursing one in particular, the BSN, and I thought this is something that I can do and build a career from. After I do get my BSN and graduate from the program, I will then be able to take the NCLEX to then be a registered nurse or the RN. We will do a pre-conference with our instructor and then get our patient assignments, and then we'll be paired with a nurse and just pretty much like start the day as a nurse would normally do, which is like get vitals, do assessments, just plan out our day and how we're going to take care of a particular patient. We would usually have labs after those to build on those clinical skills, to just have like more hands-on experience so that it prepares us for our clinicals when we do go into like the hospital setting or wherever we're being sent. And after that, the day is usually paired with a lot of study because you are in nursing school, you have to study a lot. My favorite clinical so far has been my labor and delivery clinical. I absolutely loved it there because there were a lot of like smiles and happy moments, and I literally got to see deliveries happen, both natural and C-sections, and it was such a beautiful time to see children literally being brought into the world. I had tears dropping at some point, and just like really intense relationship with like the moms, the dads, just family all together. I wish I would have known that it is okay to feel like you don't know what you're doing at times, because especially the first couple of years, you genuinely will not know what you're doing, not unless you've had some previous experience. But if you're just new into it, you have to be okay with asking a lot of questions. Do not be afraid to ask a lot of questions, to work hard, because like I said, nursing is a tedious career, but it's very, very worth it in the end. Another thing would be time management and prioritization is a huge thing in nursing, alongside with like providing the safe and quality care. The biggest impact so far, obviously aside from the clinical knowledge and clinical skills that we have, I'm going to say are the faculty here at YSU. They really support you and they truly want us to succeed, whether it be to pass our exams or to succeed in the clinical rotation. They're always available. If ever you have questions you want to ask, they're always there to ask these questions, give you advice, literally teach you how to be a nurse, and just make that transitioning between being a nursing student and a nurse very seamless. And professionally, I'm going to say another big impact that I've gotten from this program is that the skills that we've been able to learn in lab, simulation, and lectures, all these things I have been able to use on the hospital. For example, I had a summer internship last year, which was on the med-surg unit. Literally everything that I was taught in school here at YSU, from like actual patient-centered care, safe and quality care, putting in IVs, putting in Foleys, all these things I was able to use. I'm also going to add that communication with those faculties are going to be very vital, because they can also help with recommendation letters for wherever it is that you're wanting to go to. They provide all these networking opportunities, because I'm also a part of the Sigma Theta Tau Honor Society, and they've really helped me network with other nurses, not just in Ohio, but literally nationwide, or that connection with them, to talk to them, get advice, and also like get more resources.